We've learned at least one Catholic high school here in Rhode Island won't reopen. LaSalle Academy in Providence says the final day for distance learning is May 29th. For seniors, it'll be May 22nd.
Rhode Island reported 394 new cases of the virus today, the highest one-day total yet. The health department says another 16 have died as a result of the virus, bringing the total number of deaths in the state to 171.
However, the number of people in the hospital remained relatively unchanged from yesterday at 271. Number of people in intensive care and on ventilators also did not change much. Now, Governor Gina Raimondo said this afternoon that we are, quote, clearly flattening the curve, but added social distancing must continue to keep it that way.
Today, she also announced more PPE for hospital staff and special housing for frontline workers. Eyewitness News reporter Kim Kalunian joins us live from the State House with an update. Kim?
Well, Shannon and Mike, as you mentioned, LaSalle has decided to stay closed for the remainder of the school year. That's the governor's own alma mater. But today she said she hasn't yet made a decision, though she hopes to announce by the end of this week whether school buildings will remain closed for the rest of the school year. Today she took some time to outline the steps the state has taken to prepare for a surge in cases, however unlikely that may seem at this point.
We absolutely have to stay at home. It is not time to take our foot off the accelerator. If we do, we risk going backwards.
Governor Gina Raimondo cheering on Rhode Islanders to continue with social distancing efforts that she says have saved lives.
But pretty soon I'm going to be saying to you, let's be brave together, and let's get back out there under a safe set of circumstances.
But what will those set of circumstances look like? The governor says businesses should be prepared to take temperatures at the door and keep customers and staff farther apart once they're given the green light to reopen.
There's going to have to be some version of social distancing for the next year.
This as the governor announces a new wave of personal protective equipment, or PPE, for the state's medical workers.
We've received shipments totaling more than 1.5 million surgical masks. These masks we have had to scour the world for and purchase on the private market.
Raimondo says the new shipment means workers can now change their masks daily. The state reporting it spent roughly $40 million on PPE so far. That spending is eligible for federal reimbursement. The governor also announcing free quarantine housing for healthcare workers at more than 700 Brown University dorm rooms and the completion of new field hospitals, including this 550-bed setup at the Convention Center in Providence.
We don't need these now, and we may, praise God, we may never need them. But if when we reopen school there's a surge, or we go back to opening the economy, or we see a seasonal change in the fall as some predict, and we do need them, I want you in Rhode Island to know they are there, they are staffed, they are top-notch, and we will take care of you.
Now, the governor said just a few weeks ago, state models were projecting the need for 6,000 hospital beds. Again, state leaders don't believe that that will reach anywhere near that point at this time. My colleague Logan Wilbur will take you inside some of those field hospitals coming up new at 5:30. Reporting live at the State House, I'm Kim Kalunian, Eyewitness News. When it comes to knowing about flattening the curve, testing is crucial, right? Well, today, the Cleveland Clinic raised some concerns about one of the tests that Rhode Island is using, the Abbott rapid test that's being administered at that CVS testing site at Twin River Casino in Lincoln. According to new research unveiled today, they say that this test gives a false negative about 15% of the time. So today we took that concern right to the director of the Department of Health.
So these tests that are referred to are our rapid tests. And it again translates back to the importance of everyone knowing for all of the tests that we do on these specimens, it is most reliable and most accurate when it's done on persons who have symptoms. That is a key, and that element decreases the risk of the false negative percentage that is being referred to. We are aware of the concern. The tests that we have at our CVS sites that are rapid tests have been verified by retesting at our state health laboratory, and we did get consistent results on the initial set of tests that were done. And what we have with that is similar to what all states are using, and it's the best that we have. It's an important way we have to be able to expand testing. But because of that, we do talk about how to interpret the results. And as I just mentioned, we talk about getting the test obtained in the way that will decrease the risk of having those types of false negatives, because you're getting it with someone who has symptoms. But we also want people to be aware that once the test is obtained, if it's negative, if someone still has symptoms, they should still stay home and not go out if they are ill or sick with symptoms, to address any of the concerns that we have with test interpretation.
Right now, these rapid tests are only being administered at the CVS testing site at Twin River Casino in Lincoln. The other testing sites are doing a more traditional test. The CVS testing site promises results in just a few minutes. These other testing sites, it sometimes takes days for people to learn whether they've tested positive or negative. Live at the State House, I'm Kim Kalunian, Eyewitness News.